Sister Elizabeth Vetter isn't only a Salvatorian sister, she's also a registered nurse. Over 5 decades ago, Sister Betty began her lifelong ministry in healthcare.
I've been a nurse for 56 years and I graduated in 68. And how did I become a nurse? At the time I had entered, we had to submit 3 areas of ministry that we would like to be in. And that was then given to our provincial team. We got our papers back and it said, I'm going to be going into nursing. I went to Marquette nursing program and I graduated from there, and I've been a nurse all these years since.
She's worked as a missionary and geriatric nurse, but her medical and spiritual backgrounds didn't meet until her time in hospice nursing.
I had an experience one day in the hospital with this woman was dying, and her daughter came in, and the mother started talking to the daughter, and she said, I had this wonderful experience, what it was like after death. And her daughter said, oh, great, for herself. And she says, Mom, what was that experience like? And Mom was kind of looking up at the ceiling, and she said, it was just so beautiful, so beautiful. I didn't know if I wanted to come back. And her daughter tried to tell her, well, what was beautiful? What was the experience like? It was just so beautiful. It was just beautiful. And her daughter was so disappointed at the end that she couldn't get any details out of Mom what it was really like. And Mom couldn't explain it because it was just beyond words. And she was so peaceful then and ready to die.
The fusion of sister and nurse truly makes Sister Betty's ministry remarkable.
But she also had that component that with her ministry that really did ease a lot of the patients and their families' concerns, and that piece worked really well in there. It did, you could see that it did ease a lot of people's mind just to have her say, I'm Sister Betty. Not only that, but she was a really good nurse. So you put it all together, it was really nice.
Even after a long and fulfilling career, Sister Betty isn't ready to hang up her stethoscope yet. Her fellow sisters now rely on Nurse Betty to care for their healthcare needs.
I work in a semi-geriatric setting in terms of our elderly sisters who need some type of nursing care, not just the elderly sisters, but the other members of our community. I interact with any of them that have any kind of medical problems, whether they are here in the city or out in California or Arizona. So I've been to those places when there have been medical needs. I go out and spend time with them in the hospitals or whatever the needs are. They see that they have needs now that they can't fulfill, and somebody else needs to help them with that. So we journey together. That's the important thing, we journey together. It's not 2 individual persons going separate ways.
A life of ministry and service to God is the life of a Salvatorian sister.